See, I always feel that it is a good thing, right? We get to know our flaws. I'm sure nobody is perfect. Be patient. When you open a setup, don't think that for the second month or the third month onwards you'll start getting. It starts from scratch. 2-chair clinic, at least 15 to 20 lakh rupees of, a good setup I'm talking about, not an elaborate setup. Right? The space is the most important thing. After 5 years or 10 years, if you want to shift somewhere else, then everything will be doubled, the cost and all those things. No clinic will ever be a failure.
Hi viewers, I'm Dr. Prince. Welcome to my channel, Dental Treasures. So after dental course, many of us dream to set up our own clinical practice. Fortunately for some, after years of toil and working in different clinical setup, they maybe manage to run the clinic successfully. But for some unfortunate, they might be skillful, they might be aced in their academics, yet they fail and they have to shut down the clinics. So to prevent this mishap, we have a well-experienced person with us to share an in-depth knowledge how to manage the clinic. So today we're going to learn about clinical management in dental practice. So we have Mr. Prem with us. The best part of Mr. Prem is he's not from dental background, yet he successfully runs 4 dental practice in 4 different locations in Bangalore. I welcome Mr. Prem to our show.
Thank you, Dr. Prince, for giving this opportunity to me. Dr. Prince, I just wanted to correct a small thing here with my introduction. I want to be called as Prem Sudha Ramanathan. Sudha being my mother's name. She's no more with me. It's been 2 years since she's left us. I'm sure she's somewhere up there looking at me, and she's proud of all the things we have achieved. And Mummy, I want to tell that it is because of you I'm still doing all these things.
These many years into dentistry, can you tell us your journey, how it was?
Dentistry, actually my sister is a dentist, and she was working with one of her seniors for 3 years, and probably I've seen her struggle a lot as she was not given a lot of opportunities to do other treatments apart from scaling and filling. And I have also seen her doing front office jobs full time. There was no front office, there was no any assistance, so she was doing everything for the doctor there. So I really saw her struggle there. So I thought, okay, it's high time that we probably open a setup so that she would get more opportunities and more exposure. So that's how we started this. The first clinic, Dentistry, was started in 2010. Actually, Celebrity Smile started 2 years after I started dentistry. So there's a small story which I want to share, which is going to be really useful for somebody who's going to start up some clinics here. So after a year starting dentistry, one of her colleague had convinced her to open another setup, my sister. So even I was not very keen on it, but still I had to go forward because my sister was convinced, and she's the dentist, so if she can manage. Then after starting that setup, in a year's time, things went bad, where it was probably not planned properly, is what I felt, and too much of overhead costs, and we had to probably decide to shut it down, right? So I decided not to shut it down, but to sell it to another, anybody who's trying to set up any other medical kind of things there. So that time my friend wanted to open a cosmetic. So even though I had told him that this is what the situation is, but he still said that is a different field, so let me do it. So that's how I sold it to him, but I had an agreement with him saying that let the dental chair be there, right? So whenever any patient walks in, just let us know. So 15-20 minutes, because the other clinic was close by. So 15-20 minutes, the doctor will be there, so that we don't miss out on patients, right? For whatever we have seen that 1 year there. So that's how it started, and then to my surprise, 6 months, 1 year down the line, we were doing really good of whatever we were doing even previously when we handled or had the whole clinic with us. That's because of cross marketing also, cross, the other patients of the other doctors coming in and seeing us, and then all these things happening. So then it struck my mind that instead of having one particular field, if we have another one or two, so it will compensate. Some days if dental is not doing good, the other field will do good. So that's how I got this idea of clubbing dental, hair and skin and start a Celebrity Smiles. I am actually really blessed to have two partners with me. One, Dr. Sonal Somya and Dr. Rohit Prasad. They have been immensely helpful, and without them I couldn't have achieved all these things at all.
Or can you tell the art of handling multiple clinics at a time?
Was it easy? Probably, like I said, I started dentistry and gave it completely to my sister. My sister was a dentist, so she took care of it end to end. Then slowly, when the company started, I had to get in and handle the managing part of it, right? So from there, what I've seen, like I said, 2010 we started this, a complete makeover, I could say, in dentistry. For what I could see at that time, root canals and crowns. Crowns also, it's like among 10, only 2 people want to go for crowns. But now people, even the crowns are good, they want to go for veneers and lumineers, and they want to go for smile designing. So much, things have changed from that level. Not only in patient mindset, even in probably the technology, the labs, what do you say, like earlier it was like dentists used to do all the treatments here, but now it is like specialized based. We have endodontists, we have prosthodontists, we have periodontists, so it is a specialized based treatments now, right? So things have so vastly improved in this 10 years. I could just imagine for the next 10 years where are we going to go, right? So this is what I'm learning in dentistry, that it is the next thing in medical field. And about art of handling clinic, see, handling clinics, probably the previous work experiences, I own a freelancing event management company where I do a lot of event managements for fests, college fests, and wedding planning and all those things. So multiple people I have to keep coordinating with. So in that ways, it was easy for me to coordinate with different people. Like earlier, it was only the doctor doing everything, or he would have a junior doctor doing everything. Right now it is like you need to have a front office, you need to have a dental assistant, you need to have multiple doctors as well as consultants, right? So this coordination is very important. So probably it was easy for me because I could coordinate. The only thing new for me in dentistry field were doctors. So initially it was a little bit difficult, but after that I understood, right? So end of the day, what do doctors, they would need patience, right? So they would need the freedom of treating. You should not be, poking your nose into what treatments they are doing and things like that. So you give them freedom, it's good enough. That's what I have understood a little, okay, about doctors, and touch wood, till now things are going smoothly.
Your establishment helped many dentists to learn, earn, and also to set up their own clinical practice. Can you share a few experience?
A lot of dentists, yes. I've said this before that I started it because my sister was not getting opportunities, right? So I started this dentistry more so that I can give opportunities to how much of a dentist who's starting their careers. Okay, so he or she, didn't want them to undergo all these things once again, right? So slowly we started telling them that it is important to go step by step. Okay, for the first few months you do this. Diagnosing is very important. Identifying the treatments is very important. See how things are going on, right? See how the other senior doctors are talking to the patient and how they're diagnosing. So once you learn the art of it, first you need to diagnose it correctly. Then after that, then comes the treatment part. So slowly, this is how I've told the freshers who are starting their dentist career to first step by step, not directly you start doing a root canal or something like that. It doesn't happen like that, but that doesn't mean that after 3 years we are going to allow that person to do. So that's how it is. Probably by 2 years I think they learn the skills. I'm really happy that dentists who have started their careers here have gone on doing good in their lives. Okay, some people have, some doctors have set up own setups, and their setups are doing really good on the clinics. And with whatever little help I could help them out in setting up clinics, I've done it for best of my knowledge. So I don't believe in competition and all those things. I don't mind. I'll be more happy if one of my doctors are growing up in Bangalore, right? So I would feel more proud. And about work, wherever they are, see, once they are there with me, I share a little things of my experiences and all those things, because I believe in it's not only about dental treatments and all those things. There are so many other things they have to learn or develop. That is where they become a better clinicians.
As an MD, how do you handle negative feedback from patients?
Regarding the negative feedbacks, see, I always feel that it is a good thing, right? We get to know our flaws. I'm sure nobody is perfect, right? Something or the other thing keeps happening here or there. So I still feel we should get to the root cause of what has actually happened, what is the difficulty, what the patient has faced, what has happened, and then go and correct it. Because here in Celebrity Smiles, we believe, one, in ethical treatments, second thing, patient satisfaction, and making sure that we are giving 100% of whatever we could do and quality treatment. There is no compromise for this at all. So I take negative feedbacks very, very seriously.
Some of the dentists, they are very skillful and they academically sound, yet they fail in managing the clinic and ultimately they have to shut down. Why do you think this happens?
See, what I feel is, before opening the clinic, identifying a place is very, very important, right? Where you open a clinic. You shouldn't be opening a clinic somewhere close to your house where it's a walkable distance for you and convenient for you. No, you should be opening a clinic where you think that another 5 years down the line, things are going to be good. There are many apartment complexes or many residential complexes coming up, right? So you have to identify the right place, because end of the day you need patients coming here. Nowadays nobody travels, even if they have to cross a signal and come, nobody comes nowadays. So you need to be very, very careful in identifying the place. Scouting for the right place is more important than anything. Right place means there are a lot of other things also, which probably anytime we have other conversations, we can always let you know about it. So once you scout a place, after that it is like your budget. Don't go elaborate with your spendings there. Try to keep it constrained as much as possible. So if you are getting a smaller space, you don't have to spend a lot on interiors and the setup costs and the rents and all those things, which is all your overhead costs, right? So you should always be prepared that for the next 2 years, even if your clinic is not running good, even if you're not able to get the kind of money or finance where it can sustain you for that particular month, it's fine. So the next 2 years you should plan that this is not going to happen. For the next 2 years you're not going to get anything at all. So if you're ready for that, then from the third year onwards, slowly things will pick up, right? So I would still say, be patient. When you open a setup, don't think that for the second month or the third month onwards you'll start getting. It starts from scratch, zero. First 1 patient comes, 5 patients come, then 10 patients come. So if you're giving them good treatments, if you're diagnosing it correctly, if you're working ethically, people notice all these things. Then people will go and tell this to their friends or relatives or neighbors and all those things. See, that is how slowly you develop. So you keep this as 2 or 3 years at least. So don't think that a clinic becomes successful within a year. No, it takes some time. So break even, it will at least take 3 years, right? If you're lucky, 2 years. So before that, don't lose hopes and think. And after 2 years also, if it is not happening, please don't lose hope. Give it another year or so. See where you're going wrong, what can be done, and all these things. So nowadays people don't have the patience. People who don't have the patience, they just try to shut it down and see, okay, let me try something else. No, 1 more year you could have tried. If you go and open a setup in any other, once again from scratch you have to start. So rather try here itself, right? So that's where I feel that people lose hopes very soon because they are not patient. So please have patience. You're open for a particular reason, give it some time.
When do you think is the right time for a dentist to open their own private practice?
I would say at least for 3 years they should be working somewhere where they are learning, working in the right clinics where they get more exposures, where they can, not only technically develop their skills in every base, to handle a clinic, right? In every base they have to develop a clinic at least 3 years. So after that, probably they can start. But as I said, scouting a place is very important. So it will take a year also to scout for a place. So give it 3 to 5 years time. So after that, when you open, you'll be well prepared for everything what comes, because you will face a lot of challenges, a lot of things there, right? So first you have to develop your own skills. So that is more important. So that will take some time. So develop your own skills, and then after that, once you're confident in certain things, 3 to 5 years, I could say.
What should be a minimum budget to set up a decent clinic?
Once again, it depends upon which area of Bangalore we need to open it, right? So certain areas rentals are too high, right? Rentals means even advance and all those things are too high there. So it depends. So I would say that for a 2-chair clinic, at least 15 to 20 lakh rupees of a good setup. I'm talking about not an elaborate setup, a good decent setup with all the chair and latest things what is required to run a dental chain of clinics. Probably I would say anywhere between 700 to 1000 square feet. Don't go beyond it. Below 700 is too small, too congested. Above 1000 is too big. So anywhere between 700 and 1000 should be the
Ideal size.
ideal size of the clinic. So for that, 15 to 20 lakh rupees would be the budget. For a smaller budget, we could still cut short on certain things, but not on space. I would still recommend for somebody to go beyond at least 600 to have a second chair concept there, because once you start getting in patient flow and you're doing good, you want to expand it. So then going to a different place itself from there, it is better to put another chair in the same center. So even if you are constrained with the budget, don't compromise on the space, right? The space is the most important thing. After 5 years or 10 years, if you want to shift somewhere else, then everything will be doubled, the cost and all those things. So set it up in such a way that next 5 years, if things are improving, then what, right? So even if we have to pull in a lakh or 2 here or there, so for a single chair clinic, I think 10 to 12 lakh rupees is good enough. This I'm talking with the advance also. See, understand one thing, at least 3 to 5 lakh rupees would be the advance, which will be there, which is going to be there, you will be getting back the money, right? It is not that you're investing completely and losing it off. So still another 3 to 5 lakh rupees will be the advance. So the amount you're spending is probably, if you're spending 12 lakh rupees, it will be around 7 lakh rupees. 7 lakh rupees of equipments. Try to reduce on interiors that much. Don't spend it on interiors, because you cannot shift the interiors. You can always shift the equipments, right? So this I would tell for people who have a little budget constraints, right? Reduce on interiors. Try to spend more on the chairs and all the instruments there, so that when you're treating the patients, you should have the best of everything there, right? That is how you're going to develop the thing, develop your business. So probably, as I said, don't compromise on the space if you have a budget constraint also. But still, yes, it can be done between 10 to 12 lakh rupees.
Can you give us a few tips how to run a successful clinical practice?
Like identifying the right place, and then investing the right amount. We shouldn't be going over budgeted. Having the overheads covered for the next 2 years. Have some patience, which is more important, and having the right team, which includes front office assistants, doctors, consultants, lab technicians, materials, everything. You have to identify the best of all these things, set up the right team for you. I'm sure if all these things are done, no clinic will ever be a failure.
So what is the average monthly expense to run a clinic?
Average monthly expense once again the rents and the space, how much of space we have started with. The rents are the major part of the overhead budgets. Then comes the salaries, consultant cuts, lab materials, and little overhead costs here or there, right? Maintenance I'm talking about. So you could say for a 1,000 square feet clinic, anywhere between 2 lakh rupees will be your overhead costs in a decent area. If it is 700, then 1.5 would be your overhead costs. If it is in a good area, then you could say somewhere between 2.5 would be 2.5 to 3 would be an ideal monthly expense I'm talking about.
As I mentioned, some of the dentists are very skillful in their work and also they have aced in their academics. Yet when it comes to financial management, there's a lot of mishap. So do you think financial management is really important?
Yes, the financial management is quite important in this. That is what I'm trying to help out in the doctors here. The doctors here are really good in their skills or technically and with their dentistry things. Okay, so I'm trying to manage the financial and the management part here. But as I said, it is very important or equally important for them to learn these things, right? So they shouldn't be over budgeted when they're setting up the clinics, or overhead should not be too high, too elaborate and all those things. So they should be a little sensible in where they should be investing, how much they should be investing, and how they should be handling their finances, right? Even if they are good, patient flow is good, everything is good, but whatever they're earning, if he or she is paying more than what he's earning, then things will get a little difficult there. So financial management is very, very important, equally important. Like I said, you're developing your skills, please develop these things also in running a successful clinic. Things.
So where can they acquire this financial management? Because these things are not taught to us in BDS Life or MDS.
See, I said at least it takes 3 years minimum for you to set up your own clinic. So these financial managements come only when you set up your own clinics, right? So 3 to 5 years, I said. So in that meantime, you're working under somebody or you're working there. All these skills you can learn. You can learn from your seniors that how they are, as I said, diagnosing, and how the other people who are managing the finance. So every day you could keep learning something or the other. Don't constrain yourself that this is not my field, so I should be learning this. The front office will take care. No, you should know everything. When you know everything, even if you're not doing it, when you know everything, you have the knowledge, it is always good, right? So financial, I would still say, will be the most important thing of how whether it is loss or profit. Like I said, even if you're doing good, you have a lot of patients coming in, a lot of treatments are going on, a lot of things, but the overhead expenses are too high. You're spending in unnecessary things, unnecessary marketing, right? Things will not work out for you. So this is important. I would ask everybody who's opening a clinic, first try to learn this. Okay, learn this from anybody, a friend, anybody who's not only in dental things, anybody who's doing any other businesses there, like how they are doing, what they are doing, and all those things. And I would really love to help anybody who calls me up or tries to get in touch with me about finances and about all these things. So probably please do feel free to contact.
So today we'll end the part 1 of clinical management in dental practice, and stay tuned for the next episode. There's more to come.
Well, I'm afraid that some people, it is only business. Nobody's bothered about service. So these people are not going to stay for a long time. They just want to come, earn some quick bucks and go. In dental, people don't have a lot of faith in dental things nowadays, right? I'm okay to increase a little bit if the overhead charges are getting higher. Okay, let me change the career, let me go to another field. Then when I asked her why, then most common answer we get is financially we are not secure. Doctors start comparing their friends. Okay, my classmate is earning so much and I'm earning so much. Please don't compare. After 10-15 years, he's done. Maximum 15-20 years. But you as a doctor, you can continue. The more experience you get, 15-20 years afterwards, you'll be top of your career.